Hey everybody, for our discussion board this week, we are going to be addressing trauma, and many people have experienced trauma, but people are not always comfortable discussing these traumatic events in their lives and discussing what has happened to them. So, in talking about what techniques I would use if a client is reluctant to talk about what has happened to them, what traumatic event they have experienced, I think I would start by talking about what trauma is. What is trauma? What does that look like? How does it affect people? How does it affect those, the person's other people, their family and friends? And our text defines trauma as an experience that is extremely upsetting and it is at least temporarily overwhelming to the individual's internal resources and produces lasting psychological symptoms. I would want to make sure that the client understands that the environment that we are in together is very respectful, it's a compassionate environment, and that it's a very safe place for them to be able to talk. So, helping the client to feel safe and comfortable, I think, would be of utmost importance in that. And if the client asked me, why are you talking about this? It happened in the past, and why do you care so much? I would explain to my client that I do care about them. I care about my clients. I care about their well being. I want them to be as healthy as they can possibly be, as healthy and happy, and live the most productive life that they can live. And I want them to have an understanding of what's happened to them and to be able to deal with that trauma in the best possible way. And I would explain that trauma can not only affect the person who experienced that trauma, but that it does affect their family and it does affect their friends. Their circle of people are affected by this trauma. And there's this intergenerational transmission of trauma, which can happen when parents who've been traumatized can have children with this increased risk for emotional problems or behavioral problems. And often reliance on abuse of substances are how trauma survivors ease their symptoms and ease their pain from this trauma. So I would also explain to them that that is what happens sometimes, and if they've dealt with that, we can definitely look at that as well. Um, Also, medication. Many people who have had these traumatic experiences need medication. And if my client needed medication, I could definitely refer them to the appropriate doctors to do medication management and look at what they need and keep a close eye on what medications that were prescribed if needed. And when I discuss the effects of trauma on people's lives while still trying to empower them, I would let them know that trauma leaves people vulnerable. It leaves them feeling powerless very often. And we always want to look at the individual person and where they have come from and how that traumatic event could affect that person individually. I would explain to them that traumatic events affect our bodies as well as affecting our minds. And research has shown how trauma affects the brain, and there are parts of the nervous system that are affected by trauma. And sometimes our bodies hold on to these traumatic memories even when we can't completely recall them. So that's my thoughts, some of them on trauma. I hope everyone's having a good week. Thank you.